Ever wondered how dental crowns are made and how they actually get glued onto your tooth? In this quick walkthrough, we'll show you exactly what happens during a crown procedure, step by step. When there's too much damage or decay for a regular filling, a crown is used. It covers the entire tooth like a cap to protect and restore it long term. The dentist first removes any decay, then shapes the tooth into a small stub to make room for the crown. Don't worry, you'll be numb the whole time. You might feel pressure, but no pain.
Before they even ever place this new crown or cap on top of your tooth, they have to prepare your tooth first. So to prep the tooth, similar to a cavity filling procedure, the tooth decay needs to be drilled out of the tooth. The reason a crown is necessary is usually because the decay is too big or there is not enough tooth surface left to successfully place the filling, like you see here. So to protect a weak tooth from breaking, a crown is the better option to restore your tooth so it will last. Once the tooth decay is all removed, then they will prep the tooth for the crown. They shave down the tooth into a shape that will allow the crown to cover or cap right on top of it. And then, as you can see, the tooth will look like a little stump or a little stub.
To get a clean impression, the dentist may use cord or a laser to gently move the gums. They might also place a material to control bleeding around the tooth.
Then they will either use cord to pack around the gums of the stump, as you can see here, but no worries. I know it looks intense, but you won't feel any pain because they will numb you up beforehand. Sometimes you'll feel some pressure, like you'll be aware they are working in that area, but you won't feel any discomfort. And other times in some offices, instead of using the cord, they may even use a laser like you see here. So they will either use the laser or pack the cord. Next, they might place a material around the gums to prevent any bleeding. And now, although your tooth is almost ready,
Next, they'll take an impression of the prepared tooth, either digitally or with traditional putty material. This step ensures your crown fits like a glove.
before they can place a crown onto your tooth, they have to make the crown. And to make the crown, they will take an impression of the prepped tooth stub. Oftentimes, they will take either a digital impression, like you see here. Digital impressions are mostly replacing the old school impressions nowadays in most offices, but in some situations, they still may take the old school traditional impressions.
If your dentist has a milling unit, the crown is designed, milled, and polished same day, usually within 15 minutes. If sent to a lab, you'll get a temporary crown and return later for the permanent one.
The dentist will design the crown in office, and sometimes they will even fabricate the crown itself in office as well if they have a milling unit. So if they have a milling unit, they will place a block of ceramic into the milling unit. The total milling process time depends on the unit and the block material that is used, but for example, the machine in this video, it usually takes about 15 minutes to make your crown, which is pretty quick, pretty cool. So if your dental office does have the milling unit, you'll get your permanent crown the same day. Or if your office chooses to send out your crown impressions to a dental lab, then you would receive a temporary crown that first day, and then you'll return back on another day for another appointment to receive your permanent crown from the lab.
Once the crown is ready, both the crown and your tooth are prepped with bonding agents. The crown is placed, adjusted, and cemented into place, then cured with a special light to harden it.
Once the crown is ready, then your dentist would simply adjust it and polish it before they cement it or bond it onto the tooth stub in your mouth. And before they can cement it or bond it, they need to prepare the crown by etching it, rinsing it, and priming it. So now the crown is finally ready.
The dentist will remove any excess bonding material, check the bite and floss the area, and apply a liquid sealant to prevent staining.
They might use a brush to remove residual bonding material around the crown before they harden it, and then they will use the light to light cure it, aka harden it. Then the dentist will usually use an explorer to remove any residual hardened pieces of the bonding material. Then they will check the margins with the explorer and with floss floss. And lastly, they may spread liquid on it, which prevents staining and helps cure and harden.
And that's how a dental crown is made and placed. It's a precise, pain-free process designed to save your tooth and restore your smile. Keep up with your dental care, and your crown will last for years.